Our final, our final presenter is Sarah Compton, and Sarah did her practicum with Joanna Fink, who is an epidemiologist at the Gallatin City County Health Department in Bozeman. And the name of Sarah's presentation is Community Health Assessment Data Collection, Analysis, and Report Formulation. So Sarah, take it away.
Great. Thank you, Lee. Let me go ahead and share my screen real quick. Okay, here we go. Yes, thanks for the introduction. And like Lee said, I did my practicum with Gallatin City County Health Department, focusing on community health assessment, data collection, analysis, and report formulation. So of course, worked with Gallatin City County Health Department in Bozeman, Montana. Joanna Fink was my main mentor at the health department, but I also worked closely with Kate Batchelder, who's the accreditation and health equity coordinator on one of my products as well. And we'll get to that in a minute. Before I get to the main work, I did want to provide some background on the project that I helped out with. So as many of you are aware, a community health assessment and improvement plan is sort of best practice at this point in time for local health departments, and is also one of the prerequisites for public health accreditation, which Gallatin City County Health Department holds. Previous iterations of the community health assessment were done in collaboration with other community partners, notably Bozeman Health, which is the hospital in our community. But this time around, Bozeman Health went a different direction with their data and their community health assessment, which didn't fully encapsulate everything that the health department needed to evaluate. So all of that data collection and analysis, which was previously contracted out, was brought in-house for this particular project. Also, Joanna is an epidemiologist, and so having that resource on staff at the health department was also really beneficial. So I began working with the health department last fall to scope out the APE work. As again, you're probably all aware of that organizational projects and timelines don't always align with academic timelines. So it rolled over into this semester as well. Notably, the model that the health department used was one that they created on their own. Was based heavily in the work done by county health rankings and roadmaps, informed by the social determinants of health, and also a community partners stakeholder group to help provide some of that sort of really like location specific context to some of those identified health challenges that we're looking at. Okay. So the first product that I will be submitting as part of my portfolio is secondary data collection and statistical analysis. As I mentioned, like in the absence of a previously contracted research firm that was responsible for conducting and compiling that secondary data sources, that was all brought in-house at the health department. And so that's something that I assisted with. The bullet points there are just a sampling of the different data sources that we looked at and accessed and pulled data from. We did a lot of work pulling data from the US Census and the American Community Survey. But I wanted to highlight just a couple of like quick bits here, because I think that data collection is really interesting and needed to provide some context and also be able to access the data. And so specifically the Montana Continuum of Care Coalition is the organization in the state that does a homeless census once a year across the state. And so we had to first of all find out where that data was located, who owned that data, and how to access it, and then pull it into our data set. It was also, I think, an exercise in, again, providing some context around this information and making sure it is sort of accessible and beneficial to the community. One of the things that was really beneficial was Joanna's collaboration with other cohorts around the state and other health departments, and just being really clear about where that data is coming from. The Montana Continuum of Care Coalition is a pretty small organization with limited resources, and so we only really have data that they only did a census count within the city of Bozeman. So we don't have a census on homeless folks living in other communities in Gallatin County. And so having to be able to just be aware that that data is limited and what we have available to us. Another piece that I thought was sort of interesting to navigate was getting access to the Youth Risk Behavior Survey data. This is a survey one of the previous presenters mentioned that is really a product of the CDC, but administered on the state level. And being able to access that as a student, I'm not a state employee, I'm not a county employee. And so making sure that accessing that small data set specifically for Gallatin County, want to be sensitive to the use of that data, and also making sure that, that it was something that, I could, apply for and get access to. So working with the staff just to make sure that that was something that was appropriate was something that sort of tied up some of that time a little bit, but we were able to work through that. So this next slide is really busy, but I wanted to highlight, it's not data collection. It doesn't necessarily have a lovely format initially. That's something that we get to work on next. But the green rows are the indicators that I was responsible for sourcing and collecting. This is what we call the fundamentals workbook, and these fundamentals include metrics to describe the community, which include demographics, education, and economic factors, and also health outcomes, which include length and quality of life. I'm also currently working on another workbook called Health Factors, which include metrics that community partners help identify, themes like access, social and economic factors, et cetera. I want to also just give a huge call out and shout out to this is how you build systems for data collection. This is something that this is the first time that the health department has done this. And so trying to create systems so that the next iteration of health assessment will be a lighter lift, hopefully. You can see down at the very bottom of this spreadsheet, there's all these different sheets. And at the very end, there's one called the data bio, which we're able to provide additional sources and information. So for the next time, we know exactly where to go to find that data. So hopefully it's going to make it easier for the next round. Also wanted to provide just a quick example of one of the metrics that we looked at and assessed. This is a housing example. And so the table up top is the raw data that we collected from the American Community Survey through the census. We have two points in time that we're looking at, and also not just Gallatin County, but looking at Montana as a whole so that we can have something to compare that information to. I think it's a really interesting and powerful way to represent just how bananas the housing market in Gallatin County is. You can see on that graph at the bottom, the 300,000 and up is we're overtaking the state sort of leaps and bounds above what the rest of the state of Montana is at. So again, not only do you need to access the data and get it, but then how is it going to be best represented to provide good information to our community? So the next product that I worked with the staff on, and particularly with Kate, is the definitions. So the definitions is going to be included in the community health assessment report, and the definitions are aligned with the work that information that we're collecting and aligns with the data as well. So two different sort of pages of definitions we looked at. One was the health outcomes and one was health factors. Kate and I worked independently on the definitions and then met to compare and discuss the nuances and challenges with defining different areas that impact health. This was also a really, always really good conversations around well, what do we mean when we're trying to talk about, X, Y, or Z? And I have another good example here that I thought was really interesting and just was a really interesting part of our conversation, defining urban and rural. So obviously, in our minds, we urban is where people live in cities and rural is where people don't. But, you need to be able to quantify that. And especially if we're using that information to help people understand more of the context around what's included in the community health assessment, it's really important to be able to be as specific as possible with all of that. So the US Census, that's the definition that we use, defines rural as anywhere outside of an urban area, and urban is defined as an area encompassing at least 2,000 housing units or have a population of at least 5,000. That's again where we pulled the actual metric from was the US Census, and so we wanted to match that definition. One of the things that we did find out is that there's lots of different definitions about what urban and rural is, and even within different federal agencies. So again, looking at the data, matching it to the appropriate definition to create that consistency throughout the report was really important. Here are the list of competencies that I addressed in this work. I'll let you read through those. In the interest of time, I want to move along to some lessons learned. I think I've sort of already highlighted that it's really important to be thoughtful about data and how it is interpreted, to provide as much context as possible. There are a lot of resources and benchmarks and tools that are available. And so it was a really, I think, enriching and interesting experience just to be able to do some pretty deep dives into what it means when we're looking at different data sets. Still working on doing some statistical analysis with R, which is one of the things that I was really interested in working through. The CDC actually has its own code book for R to assist with data analysis, which I think is a really great, there's just so many resources out there that are available to people who don't have a lot of statistical background, and for local health departments and anybody else who wants to look at that data, who needs a place to start and some guidance. So it's really helpful to have that. I would also say that behind every data set is a person or a team of people who have collected that data, who want to share that data with you. I think, it's, I think, a really great opportunity to continue to build relationships and collaborations with people who, could continue to be good community partners in the work that local health departments are continuing to do. And also, that's, I think, some of the point of being able to collect that data is to be able to have a venue to share it with the community and to people who, might find that really valuable. So, thanks again, everybody. I want to specifically thank, again, my site mentors and also DPHHS for their support in this project as well. So thank you.
Thanks, Sarah.